All right, now a warning for people who take Ambien. A government report out this morning reveals dangerous side effects with the popular sleeping pill and its generic versions. Between 2005 and 2010, there was a 220% jump in visits to the emergency room. Dr. Polly Phillips is with us. Good morning, doctor. So we've been talking about this, new warnings about Ambien, and now this record visit to hospitals. Why is that?
You know, Ambien and, of course, its generic version, Zolpidem, they are so prescribed, meaning outrageous numbers. You know, 44 million prescriptions were filled just last year, so we have to assume even many more were written. So I think what's happening, what I find in practice, is that both doctors and patients now think of the drug as not serious just because it's so common. A lot of patients say, oh, you know, I'll just take an Ambien. But it is serious, especially for women. And just in January, the FDA actually decreased the dosage for women by half.
Why women? Yeah. Go ahead. Go ahead.
Affects women different than men?
It does. It really has to do with metabolism in the liver, and it stays in our bloodstream longer. 2/3 of those ER visits were actually in women. And, you know, the other group that runs into trouble are the elderly, primarily because they're more likely to mix Ambien with other drugs.
I take Ambien when I'm traveling overseas. What sort of bad reactions do people have?
Well, some of the ER visits involved things like hallucinations, behavioral changes, things like agitation, and then the more bizarre side effects like sleep driving, sleep walking, sleep eating, where you're in this sort of half state of sleep, but you're also awake and functioning.
Yeah. This is not funny, but I mean, someone I know said they ate a whole cake after taking an Ambien pill. I mean, they just kind of blacked out after it.
It's true. People really are experiencing some severe side effects.
But is that something wrong with the drug, or they're taking too much of the drug, or just people have different reactions to the drug?
You know, what I think it is a lot of it has to do, 50% of the ER visits had to do with mixing the drug with other drugs. So you really can't take it if you're taking any pain medicines, any anti-anxiety medicines, or don't mix it with alcohol. But really, I just advise we follow this mantra. Take the smallest dose possible for the shortest amount of time. It's not a drug to be used every day.
Good advice. Thank you, doctor.